All right, next we have Aria Vazirnia. He is in private practice in Beverly Hills, going to be talking about understanding the differences between tumescent anesthesia, water-assisted liposuction, and the wet technique.
Thank you very much. It's a great pleasure to be here. I'm Aria Vazirnia. I'm a dermatologic surgeon practicing in Southern California at the Roxbury Institute, along with colleagues Dr. David Amron, Dr. David Smart, and Dr. Sean Mashrefi. And we're part of the Advanced Lipedema Treatment Program. It's a comprehensive program for the diagnosis and treatment for lipedema. And we're going to be talking about something important. It's just tumescent anesthesia. It's a simple yet important topic because tumescent anesthesia was very revolutionary in liposuction surgeries. And I'm going to be discussing the differences between that and something called water-assisted liposuction, WAL, and the wet technique with liposuction. So, sorry, there we go. Can we go to green button? Okay, great. Okay, no disclosures. Okay, as a summary, we're going to talk about tumescence, a brief history of tumescent anesthesia, definitions, and safety data. So tumescence is the state of being swollen, to swell. And in the setting of tumescent anesthesia, it's infiltrating dilute amounts of anesthetic subcutaneously into that fat layer and swelling it up. So we expand that layer with that tumescent anesthetic fluid. And what that does is that in the picture to the right, you see that that tissue that's being tumesced, it's turning a little bit whitish in color. We call that blanching, as well as it develops the texture of a peau d'orange, more of an orange peel texture. And that's the endpoint we look for when we do tumescent anesthesia. So you take an orange, and you look at the skin, and that is the texture. That's the swelling that happens in the subdermal area that creates that texture. So, brief history of tumescent anesthesia. So just go back in time. Liposuction was first developed by Dr. Giorgio Fischer, a gynecologist in Italy in 1976, doing more of a dry technique using large or hollow bore needles under general anesthesia. But with that technique, there was a lot of blood loss, blunt trauma. So later, we had the introduction of using these wetting solutions, the wet technique with general anesthesia, and later the modified wet technique with sedation, basically putting fluid into that subcutaneous space. And that fluid has a little bit of epinephrine, tiny amounts, as well as anesthetic to go ahead and really, it's more to reduce the blood loss, not really for the anesthesia. Because a lot of these cases or all these cases were being done under either general anesthesia and later under heavy sedation. But it wasn't until the late 1980s when derm surgeon Dr. Jeffrey Klein developed the tumescent anesthesia approach, which was so revolutionary because of its safety profile, as well as reducing a lot of that blood loss. And that's Dr. Klein, that's his original textbook. And definitions. So a few things we're going to define: dry technique, wet technique, super wet technique. So dry technique, as it sounds like, it's doing liposuction with no fluid infiltrated into that fatty layer. So no infiltration of fluid, but the blood loss is significant. Very, very few people now practice the dry technique, but most of the time, wetting solutions or tumescent anesthesia is used. So the wet technique starts to involve small amounts of this, what we call a wetting solution, which contains very tiny amounts of epinephrine, as well as a little bit of lidocaine. It's really to reduce the blood loss. It's not really for the anesthetic effect, because under wet technique, patients are still under general anesthesia. And then super wet technique just adds a little bit more of that fluid, significantly bringing down that blood loss. Now, tumescent anesthesia, large volumes of a dilute local anesthetic with epinephrine, with a little bit of sodium bicarb, injected into that subcutaneous tissue to make the tissue truly swollen. It's to create a truly anesthetic plane, and when you properly prepare that tissue, you can go ahead and and not need to do general anesthesia or conscious sedation. Blood loss is less than 1% of the aspirate, and that's due to the hydrostatic pressure and vasoconstriction of the vessels. So complete tumescence of the tissue is key, gives you proper anesthesia. Hydrodissects the tissue, meaning that fluid actually pulls the fat lobules apart from one another, reduces bleeding, reduce damage to lymphatics, which is very important. And cadaver studies going back to 2004 actually go ahead and show that there's significant damage to the lymphatics. And I like to say ballooning of the connective tissue layer between the skin and the muscle to expand that safety plane. Now, one of my slides fell off, but WAL, water-assisted liposuction, is now synonymous with a device that uses a spray tool to go ahead simultaneously spray anesthetic and suction at the same time. Now this tool, this device, it's nice because it allows less volumes of anesthetic to be used. It's safe for the lymphatics. The safety data is pretty good. It's just a little bit slower to use, and you cannot properly go ahead and tumescent an entire area first. You have to do it piece by piece as you're doing the liposuction procedure. So now when we talk about, this is a lot of text on this slide, but briefly I'm just going to say the recommended maximum dose is 55 milligrams per kilogram of body weight. This is key for when we're doing tumescent anesthesia because above that 55 milligrams per kilogram, we get into toxic levels of lidocaine. So this is one of the reasons why we're very, very OCD about staying below that 55 milligram per kilogram amount, and that's one of the reasons why we like to separate some of our surgeries into multiple surgeries because we want to stay within the safe amount of lidocaine we can give for tumescent procedures. Safety data is phenomenal. Thousands of patients have been treated under just tumescent anesthesia, and what unites a lot of these studies is that there have been 0 deaths, 0. One study showed no perforations, no thromboemboli. Another study showed with 9,000 cases, no injury to deeper structures. So again, you can see that just pure tumescent anesthesia is phenomenal in terms of safety data. So when we're doing large volume liposuction cases, it's important to also note the fluid input and output. Input is the IV fluids given, any volume of the tumescent anesthetic actually given. The total output is that urine output, the actual aspirate itself, and the difference between the two is what we call the residual volume, and that's what is within the patient. That's the fluid that gets absorbed eventually into that intravascular space, which is inside the blood vessels essentially. But that's why we have to take good caution with patients who have a little bit of, have cardiac or pulmonary disease. That's why it's very important to get even medical clearance for a lot of these procedures. So we want to make sure they're monitoring their cardiac and pulmonary status before going forward. So in summary, tumescent liposuction can be done safely, low complication rate, 0 deaths. Tumescent fluid gives anesthesia, reduces bleeding, even analgesia in the immediate post-operative period because that fluid coats the tissues. So after the surgery, it gives you a little bit of pain relief, protection of the lymphatics, and expands the safe plane. Thank you very much.
All right.